Hello, everybody. Thank you for joining us on another episode of the newly changed. I just changed the title, the name of this podcast to the Move the City Forward podcast, powered by My City, My Health. And today I have another conversation with the great panelists at this year's My City, My Health conference in Des Moines, starting November 13th. Amal, thank you so much for not only for being here and kind of talking about what you do, but just being a part of the conference this year. Like, we're going to get into it, but like you have so much experience and knowledge within the housing and planning space and a bunch of other things. I'll let you talk more about that since you could do that a little more eloquently. But thank you so much for being here.
Thank you so much for having me. I've been a long time admirer of your work and the podcast for sure, and the conference, so I'm very excited to be part of
No,
it
I
this year.
appreciate that. I'm so is it's what I don't take for granted is a yes. Like when you're asking someone to take time out of their day to be at a conference to talk about something that is a passion of theirs, but like, there's time and energy into it. Like I never take that for granted. So it's like that yes was so cool. So I appreciate that. So before we get on to that, tell people a little bit about who you are, what you do, and your experience.
Yes. So I am an urban planner that wears many hats, and a few of those include being a full-time PhD candidate at the moment, based out of the University of Amsterdam in the Netherlands. I am also an active researcher in the housing landscape, having spent about 12 years now in the nonprofit affordable housing sector. Primarily having worked in Iowa in Des Moines Metro, but also having spent some time in Hennepin County in the Twin Cities. And on the side, I also pursue creative projects focused on documentary filmmaking that primarily align with some of the housing advocacy work that I do, but then also some of the teaching that I started doing about a year ago as part of my PhD education. So I use film as a creative practice for advocacy and storytelling, but then also film as a teaching and a methodological instrument in the classroom, but then also outside of the classroom.
Yeah, which is first of all so impactful. I don't I don't think people really appreciate the power of storytelling when it comes to educating. Like
Mm.
there is so much in that. And you even gave me a bar. I only remember this a couple months ago. We were at the oh my God, what was that? Where were we
At
at?
the Community Foundation luncheon, I believe.
Community
Yeah.
Foundation luncheon. And just like the idea of not trying to dictate where the story goes, just let it flow out. And I'm like, man, and then after that, the interviews I've had ever since is like I'm hearing this difference, like, oh my gosh, this story is developing that is like not not what I thought it was going to be, but like what it has to be. It's like, oh, this what I thought I wanted to say is like, okay, cool, but this is a different story that these men are saying. So I appreciate that. It's that little like, hey, don't you worry about that other stuff in post, but like you do this right now. That was really, really beneficial for me in the moment. 'Cause I was going through it. I was like, man, they ain't I ask them one question and they go on a tangent about something totally different. And it's like, well, maybe that's what has to happen. And so let go of that. And it's been really, really cool. That's awesome. You give a different perspective to this housing panel than any other person on the panel. Honestly, like the panel is called "Housing is Medicine," but I would love to know more about like when you think about housing. What is the mindset that you go into? Like, okay, is it something like how do we solve this? Like, what is that mindset you go into when you think about kind of the housing issues that we have here?
Yeah. So I start from the understanding that housing is affordable, accessible, stable, and quality housing is a basic human right. I think that's the understanding of housing that kind of shapes all of my interactions and engagements related to the housing sector. And from that kind of foundational understanding and thought process, it's impossible to think about housing as a as a single system that stands on its own, right? You have to think about it from a very holistic perspective and understand that it's a system that is interconnected, and uh, codependent on a lot of other systems that surround it, in the same way that you would hope that your physician to treat you like a whole person. You want anyone that is in housing in your community to think about housing in a holistic way, that looks at the ways that housing intersects with the broader physical built environment, what kinds of access to green infrastructure, to critical amenities like grocery stores and healthcare facilities do you have? Thinking about housing in connection to employment and economic mobility access. Thinking about housing in relationship to school and education. What kinds of services are available to children within that broader environment. So housing is connected to everything, and I think for me, that's something that that connecting point is something that I have been in many ways advocating for in meeting towards in the middle, and hoping that more people will come to that type of understanding. So when your conference, the panel, the opportunity came to participate in this panel, and think about housing in relationship to health, it just felt like a really perfect fit and at the perfect time in that, housing is health, right? And I think um, the more of our community members and our leaders are able to understand that and grasp that and act on that opportunity to think about the interrelationship between housing and health and all of the other systems that shape our everyday life, I think the more success we'll have in being able to understand the challenges that we're facing and then also develop solutions together to address those challenges.
No, 100%. Like, I find it interesting that it's for some people, not all, but it's so hard to wrap their mind around the idea that somebody's housing can be associated or connected to that person's health. Um, and just being in the space for how long I was, especially working um, in at a safety net hospital, in having a diabetic in my office and talking about exercise or talking about um, how we can improve that, and housing coming up as like, well, housing as far as like, well, where my home is and things like that. Like, I'm not walking outside. Like, the walkability is, I'm not doing that. Or um just the idea of like, for the the respect for your home, like having a home that you have some pride in too. And I feel like we see these, I hate to call them projects, but that all these different areas where like the housing is just, I wouldn't want to live there either.
Mhm.
Right. And like when you think, what what would it look like if people who had the power to do so improve these housing areas, improve what was around them, and what we could see, the benefits we can see from the people that are living in those areas. I don't think a lot of people can really wrap their minds around that. Is that a challenge that you've seen, or like what are some conversations you've had with people that just cannot make that connection?
Yeah, I think there is a level of disconnect and detachment that exists, right? In that for many of us that are in a position of privilege and have certain access to um, basic resources, right? We're thinking about these kinds of issues and people that are experiencing these types of issues as an other, right?
Yeah.
There's a level of security and distance that exists between myself and the kinds of resources that I have access to and privileges that I get to enjoy every day. And then that person on the other side of the street that is perhaps struggling with various levels of crises and instabilities that ultimately end up impacting their health and housing. And that distance, I think, bridging that distance, I think that responsibility lies on us, right? Um, it's the privileged person's responsibility to bridge that distance and understand that we're there are certain kinds of biases that make it difficult for us to truly and meaningfully kind of interrogate the kinds of conditions, structural conditions that create an environment where we have certain members of our neighbors, our friends, family members, or people that are in part of our life or our circle within our community, one degree or another, that are struggling with these issues, right? Um, so I think it starts from finding a way to not other the other, right?
Mhm.
And what kinds of conversations does that reduction in distance, right? The social, emotional, physical distance between myself and the other who is struggling. Um, what does reducing that distance allow us to do, right?
Yeah, I love that because for a lot of people, I can only assume not everybody, but like there's that thought of, oh, that's a personal problem, not a community problem, right?
Yeah.
Like, oh, I'm over here, like, this is what I do. I got my own problems, and you know, I'm in this space of privilege of where I can drive by all of these, all of what's going on in this community and then go to my safe home and comfortable home and oh man, it's 101 degrees outside. Let me go to my 65-degree home
Yeah.
and not worry about my community or or my neighbor. And the idea what I am hoping, especially for those who attend My City, My Health, right? Because we have a lot of nurses. And I maybe brought this up in our meeting. We have nurses and we have um, there are social workers that understand the community advocates, but those that are in healthcare are like, okay, well, I only see them when they're in the clinic. So how do I, as clinical staff or someone that only sees them once every 3 months for their, quarterly checkup on their A1C or their yearly physical or whatever it is, what am I going to do about this housing situation? And I'm curious, one, what your answer to that would be, and two, getting to understand, like, oh, I can actually do something.
Yeah. I think for me, I would say, and this is something that I've practiced all of my professional career, and probably also my younger days, is it's showing up in unexpected places
Mm,
in an effort to form unexpected relationships because you don't know where that might lead you. So in the planning world, our work is heavily centered on relationships, right? And engaging with communities and finding new and meaningful and adaptive ways of engaging with communities that help us get towards answers that help them shape the kind of future and vision for their community that gets them to where they want to be, right? And oftentimes our work is is and can be quite transactional, right? And I think that can be said for a lot of fields, right? And we think about the political climate or the political realm. Like, when do we have interactions with leaders in our community? Oftentimes, it's when they need something from us, right? And that often is also, you can think about that kind of transactional relationship in the healthcare setting as well, where as patients, we often go to a doctor's office when there's something wrong, right?
right.
So I think what we need to be asking as individuals in positions of decision making or in positions of care where we're providing care, it's figuring out, obviously your time with an individual is very limited, and then also what you're able to do outside of your particular field is very limited. What can you do in the limited time that you do have to be able to build unexpected relationships and show by showing up in unexpected places? And this is why I think, I mean, the housing world is so vast, and it's made up of a network of complex relationships and actors. Um, and the more well versed you become in your local housing system, um, by being connected to a very diverse set of individuals within your community that have one connection or another in that world, I think the more meaningful and perhaps productive your support and service delivery to your clients would become, right? So think about as a service provider who has to rely heavily on the referral network to be able to
Yeah.
deliver the best care and support to your patient or your client, by knowing landlords or property management companies in your community that have um, to varying degrees that practice inclusive rental screening criteria. Um, having knowledge of who those landlords or property management companies are, so that way when you have a client in dire need, you're able to pick up the phone or give them the number, and they might have a shorter time to access housing than if you didn't have that connection, right?
Mm.
Or imagine if you had a connection to um, a local developer or a group of advocates that you're able to share some of the data or some of the anecdotal kind of experiences that you're seeing show up in your exam room, that you're able to share with them with respect for confidentiality and privacy, of course. And then ongoing conversations with those individuals end up shaping maybe 4 years 5 years from now the kind of housing that they end up pursuing and building in your community. So I think that was a very long-winded way of saying I think we need to show up where we're not expected and we're not
Yeah.
expecting anything, and then find out what kinds of conversations we're able to have that not only expand our understanding of what our clients or patients are going through, but then also what resources are available in the community, and then also what's missing in our community, and how can we find ways to support ongoing advocacy efforts in that space, but then also other ways of engagement and yeah.
Yeah, no, I love it. And I'm gonna put one foot on the soapbox, not both. But like, but like you said something, we talk a lot about, that community clinical linkage and like things like that. And the only link that a lot of these health systems have to the community is to the homeless shelter, right? It's like, up, you need housing, here's a referral to the homeless shelter. And the idea of what you were just saying of, well, what about the developer? Or what about, there are people out here that could support, it's not being done. And also there are a lot of things where I believe there needs to be a cleansing of the workflows and processes of how we do things within these clinics. And that is a whole nother conversation of like, there has been this, when you're so used to doing something one way. Cause I hear from clinics all the time of like, well, I have someone that says they need housing or insert whatever social need, and all I can send it to is the resource I have, and it's frustrating because they've either used that resource multiple times already, and I had nothing else. And it's like, well, okay, what are we doing to look outside the box? And what you said as far as being in unexpected places, like, was it is I don't think that type of thinking is happening right now, which would be really, really exciting to kind of bring that up and see what that can look like going forward. And like, what can we do with that? What can happen there? Man, that is okay. My wheels are turning, and that is really, really good. What got you into this work? Like, what was it that you were like, oh, this is where I want to plant my flag?
Yeah, it wasn't a linear path, but when I was in college, I volunteered a lot for a lot of housing nonprofits at near the university where I attended in Omaha. And then when I graduated, I ended up doing a year of service through AmeriCorps with Habitat for Humanity in the Greater Des Moines area. And then I ended up moving to the Twin Cities and ended up working for a social services organization that was embedded within the Hennepin County coordinated entry centralized intake homelessness system. So I spent about a year and a half in that landscape, and that was kind of probably the most eye opening kind of moment for me that really um, helped me understand and make sense of the s- the systemic kind of um, issues at play that were generating the kinds of daily outcomes that we were seeing in the lives of individuals that were navigating various levels of crises. Um, and for me, I mean, that was kind of my very first interaction with the homelessness system in the country in my at the time. And while it doesn't work perfectly, and it has since evolved. It's been over a decade since I've worked in that in Hennepin County. It's evolved tremendously since I've been there. I think it I was working for families that were I had a client load of about, anywhere between 26 to 30 clients that were families in my as part of my caseload at any given moment in time, and some of them were already stably housed when I joined the organization and started working with them, and some of them I ended up working with them from the moment in time that they, entered the system, and then worked with them as they moved on into stable housing, and once they were housed, working with them to maintain their housing, right? And that requires connecting them to various other support systems. And in that short time that I was there, I learned so much by being a companion
Mm.
to these families that I was working with. We would spend hours just waiting in line or waiting in waiting
Man,
rooms, as I waited with them to apply for different kinds of benefits, to enroll their kids or re-enroll their kids in school, to access mental health and physical health services. There was, I mean, there would be appointments with clients where we would be waiting for like 4 or 5 hours for a single service. And I think the amount of time I spent sitting with them, waiting with them, walking with them, driving with them, and alongside all of the housing related work that we were doing, right? There was a lot of landlord tenant mediation that we were doing in an effort to prevent a landlord from filing an eviction, because the tenant
right.
had violated their lease for one reason or another. It really helped me understand, how much our system, or how, whether it's our housing system or our health system or our social services system, robs people of basic necessities, and what happens when people are have they've lost everything, and they're trying to pick up the pieces of their lives together to rebuild their life for themselves and their families. How much effort it takes to get one piece of that puzzle back into
Mhm.
place. And as we know, time is it's we don't have the same level of
Yeah.
access to time, right? So 1 hour of your time is not equal to 1 hour of my time, right? And how much waiting and being in line for to access critical services costs them, right?
Yeah.
Um, so that was a very eye-opening experience for me, and in that time period, during that time, I've realized that perhaps the way that I might be able to kind of productively channel my frustrations and make impact, is by going back to school and pursuing a degree in planning. Because at the end of the day, for me, I think everything comes back to, what does or doesn't our built environment make possible, right?
Mhm.
And if you spend some time just thinking about our history, regardless of kind of where you are in the world or in this community, if you think some time kind of thinking about if you take some time to think about, um, the history of your community, where you're currently at in time and space, and what kinds of futuring is happening around you for the community that you are in, you're able to make a lot of sense of a lot of things, right? And
Yeah.
understand that the life that you have is it's definitely the result of a lot of your hard work and effort and the resources that you've had access to over the years. But a lot of it is also has had less to do with you than the history of the place that you are in and the future of that place, right?
Man,
Um, and planning is kind of where all of that happens, right? So and then I when I finished school, housing was just kind of the it place for me. I couldn't figure out a better place to be and to land, and so I came back and found work that was kind of at the intersection of housing and social services, and have since been in the nonprofit housing world.
man. That's cool. First of all, that's so dope. The other thing is, similarly, there is nothing more eye-opening than being on the front line of something. I can read about health disparities in like all I won in college. It wasn't until I was working with someone that had an A1C at 13 and got $50 in food assistance and supplemented with the food pantry to be like, oh, this is different. Right? Like it's just way more educational and it opens you up. But the other thing is I wanna ask though, like how important it how important is it to have someone like you in that space to be able to, I don't know if advocate is the right word in the planning space, but like, um, why is it important for someone who has your background and your knowledge and your not only professional experience but lived experience to be in that space?
Yeah, I think for me it's the kinds of conversations my career has allowed me to have. I think that make a whole world of a difference in that over the course of my time in the field, I've worked very closely with landlords, property owners, property management companies, with residents across the housing spectrum, right? I've worked with social service agencies, providing various levels of resources to tenants of various need, um, and and I have also in that time period have intentionally stayed away from working in public office or like in a traditional planning setting, working in a for a public planning agency or even a private planning agency, because I think for me, what has always been front and center and very important is finding a way to do planning work in a way um, that was missing, that wasn't there. And oftentimes that means you might ruffle a few feathers. It means that you have to speak up and say and stand up for things that you believe in that may not perfectly kind of mold into the way of doing business, right? Um, but I think being so I think of myself as a planner working from the outside in, and I think one of the things that allows me to do is have conversations with planners or people in planning adjacent fields um, about the ways that perhaps we're not taking into consideration things and individuals and communities that we should be taking into consideration, and that we should be taken into consideration in a way that is more than checking a box,
Right.
right? And that's also the other way around in that I'm having been in the nonprofit sector for as long as I have. I think one of the most meaningful things that I have been able to do having this planning background is that I'm able to point out to them, whether we're sitting in a boardroom, figuring out what our priorities will be in
Right.
the next 3 5 years as part of our strategic plan, or figuring out where funding might um, how funding strategy might take shape based on the needs that we're seeing in our community. It's bringing to attention how we might be able to involve planners and shape local plans in ways that better align with the needs that they are seeing, right?
Right.
And the needs that they are seeking to affect change towards. Because oftentimes there's uh, we talked earlier on the side about the ways that our most of our lives we're kind of operating in silos, right? Whether as individuals across organizations or across fields, this is also happening. The siloism is in my opinion very pronounced um, within fields that are very adjacent to each other and that should be in regular contact with each other, right?
Right.
So all of the organizations in our community that are doing housing related work, social services work, um, a- anything to do with critical service delivery in our community should be in ongoing conversations with local planning institutions, right, at various levels,
Right.
whether it's a metropolitan planning organization or local funding agency, municipal government, county government, and there is some of that connection and overlap and planning that happens, but I think beyond kind of like the leadership level, I think across the board, vertically and horizontally, I think there isn't enough knowing of what the other hand is doing, in an effort
Mhm.
to kind of more coordinatedly realize the shared goals and priorities that we have as a community.
Yeah, and not only the shared goals, but like the knowledge that we all the different knowledge bases we all have, like bringing those together to be able to actually move some action and move some things forward, and do something different. I think that yeah, I totally agree. Amal, November 13th, My City, My Health. What is something that you're hoping the audience or the attendees walk away from our conversation that we'll be having around housing?
Mhm. Yeah, I think I one of the things that I hope is for the audience to walk away knowing why and how housing is health and vice versa, health is housing. And perhaps also walk away with some tangible kind of understanding of where the gaps might be in our community based on the entire conference agenda, and then what resources exist, what organizations are there already doing the work,
Mhm.
and how might the work of another organization overlap with the work that you're doing as someone in another organization, and where might there be possibilities for collaboration or conversation that could possibly lead to something more. So I think the I hope that the biggest takeaway beyond, knowing why and how housing is health and health is housing is fine for them to walk away feeling like there's possibility for more and having maybe one or two kind of tangible takeaways that they can act on that kind of
No,
um,
love it. I love it. Yeah, I'm so excited for just the speakers that we have on this. I feel like if you all each were your own organization, we're talking about breaking silos, like that this is a silo breaking panel.
yeah.
Like it's so cool to see that. So those November 13th, go to mycity.health. You can see all the panels, the rest of them are on there. And you can also register. So that'd be great. Thank you so much for doing this. I really, really appreciate it. What are you looking forward to for the conference? I should ask you that. What are you looking forward to?
Yeah, so this conference is happening at a very timely period for me because I had just returned back
Yeah.
home earlier this year. So I'm having been away for almost 3.5 years. I'm kind of in the rebuilding stages of things, so I'm reconnecting
Yeah.
with uh, friends and making new friends in the community, and so I'm looking forward to meeting new people and old friends as well that I could have
Yeah.
conversations with that then allow me to say. there's more that I could do and more that we could do, and how can we do that together?
Awesome. And
Yeah.
I'm gonna leave it with that. Also, thank you so much for being here.
Thank you.
Everybody, thank you for listening to the Move the City Forward podcast. Go register for the conference. All links to connect with everybody, Amal, anybody will be in the description of this episode. We'll holler at you next time.